Number of health issues that we are taking a look at here on eNCA throughout today. One of those, of course, being the situation over at Barra. The other is the collection of medical waste from Gauteng hospitals and clinics has been disrupted. The service has been stopped, we understand, because they have not been paid by the provincial health department. Just how dangerous is this for our health and for the health of those at the hospitals? Progressive Health Forum's Dr. Aslam Dasoo joining us. Dr. Dasoo, always good to have you on eNCA. Medical waste is not something we ordinarily would have a problem with here in South Africa. It's a very well-oiled machine, but it's suddenly come to a grinding halt. How bad is this, to your understanding?
Good morning. It's actually quite awful. And you're right. It's a very routine function in all medical facilities everywhere in the world. And we have a very good system here in our country. It's not even around the country, depending on how well it's managed. But certainly here in Gauteng, we've not had any problems until now. And what is really shocking about this is that this company that has now withdrawn its services continued to provide services over the last 2 years without being paid, or without being paid in full. And that's, I think, because as a medical company, it is also required to behave as an essential service. But I think it reached the end of its tether in February because it just wouldn't be paid. And this is a serial problem in the Gauteng Department of Health, and withdrew its services to the great detriment of the facilities as they stand now.
Is there any alternative for the disposal of medical waste if it's not done through these sorts of channels? Could we see private companies now coming in to, for example, fill that void? Because I would imagine this is not just a case of having rubbish taken away. There's a much bigger and more stringent process involved.
Yes, of course it is. And I think, this company is a private company. It's geared to doing this. It runs, I think, most of the hospitals in Gauteng. And no, you can't just dispose of medical waste as you would in a pick-it-up bag. Here, the waste has to be properly receptacled in a regulated way, taken to regulated sites and disposed of in a regulated manner. And there's no other way of doing this, given the toxicity and the risk involved in a lot of this waste. Look, there's always the possibility that other companies could come in and do it. There are many companies who can. But no one's going to step in if they're not going to get paid. And so you have to go back to the source. If you can't provide bread and milk for your patients on a regular, uninterrupted basis, something as elementary as that, and if you can't arrange for medical waste to be taken off the facility's hands, you are failing in the most elementary functions of running a system. And there's no getting around that for the Gauteng Department of Health, which has been a serial villain in so many difficulties faced by the health system in Gauteng, the most comprehensive, the most complex medical system on this continent.
We know about the issue at Barra, and this is partly what you're alluding to, Doctor. So perhaps let's bring that into the conversation if we could. So once again, we have medical experts, we have medical waste not being handled, and many people coming out and saying that once again the Gauteng Department of Health is simply failing patients and doctors and caregivers in this province. Would that be fair?
That would be most fair, and we stand in complete solidarity with our colleagues there. And here's an interesting phenomenon. It's very rare to find clinicians. We see, lots of industrial action by general staff, from employment disputes. But for professional staff to stand up like this is kind of a new thing. And that's, for the reason that as employees of the state, they are forbidden from speaking out and are victimized when they do. And this Gauteng Department of Health is a particularly egregious employer as far as that is concerned over the years. But the fact that they're stepping out is going to start a cascade everywhere. I think the Gauteng Department of Health has lost any authority, moral or otherwise. Now, these clinicians went well beyond the call of duty and worked so hard during the pandemic that they overcame the obvious deficiencies of the system to try and help. They were the last line of defense. To continue to treat them in this way, where you can allow waste to, pile up, have a stench in the hospital that is just awful, force them to work because they haven't fixed Charlotte with up to 500% more patient load without increasing posts, increasing resources. You have to ask yourself, what is this government doing? It's really awful.
It is, and Doctor, I was going to ask you this as a last brief question as well, because you mentioned now Charlotte. We know the issue over at Barra. Some 800 contract workers going to be out of work by the end of this month because there's no money for that. Are you getting a sense then that we are reaching a tipping point and we are waiting for a disaster? Perhaps patients' lives being put in danger if Gauteng Health doesn't get its act together. Last brief answer, please.
Yes, no, we've already passed that point. On a daily basis, we are finding preventable deaths as a result of this mismanagement on a scale of life is many on a daily basis. There's just no question about that. So this tipping point has been reached, and what is really concerning is that a dereliction of duty and combined with an abuse of power has resulted in criminal negligence. That department has to be put under administration immediately by National Treasury, not by the province, so that we can stabilize the system.
Well, I appreciate your time, Dr. Aslam Dasoo, for always speaking to us here on eNCA, convener of the Progressive Health Forum. And Tums, that's one of those stories we're looking at later, is the situation over at Barra, end of the month, because there's no money to pay. But then questions have to be asked. Payment for Cuban doctors during the height of the pandemic, and 50 million rand given to Cuba, plus money being spent elsewhere. Now we might have staff out of jobs, patients not being taken care of properly, basics like food at Barra, not getting there. Still issues at Charlotte eNCA Hospital as well. There's a lot wrong with the department at the moment. We need to try and get to the bottom of how quickly we can fix this.
And hopefully, of course, the Gauteng Department of Health will bring in that clarity and some answers, because we can imagine 800 doctors out of work. Where will they be placed? Where did that budget go that was meant to cater for them and their salaries? Thanks, partner. We'll be sure to get those news, of course, and views right here on the South African Morning.